Okay, just a few more minutes and then we'll get started. So if you can just hang tight and bear with us, this is our first Zoom press conference if we run into any technical difficulties. All right, Russell, whenever you're ready, you can get started.
Good morning, everyone. I'm Russell Myers, CEO of Midland Health. This is our Unified Command Team update for this Monday, Thursday, April 9th, 2020. This is the first of the Unified Command Team briefings that we're holding by video conference, each of us in our own space. And I'll start off with the Midland Health update here at the top. Numbers for the state of Texas. Over 9,300 confirmed cases now, 30 cases in Midland County that are confirmed. In the state of Texas, there are 177 deaths and 1 death so far in Midland County. Testing that the hospital has sponsored, 673 patients have been tested so far, 28 positives of those, 510 negatives, so less than 5% positives. We're waiting on results for the past couple of days. That totals about 130 patients. The hospital census is 130 today, still under half of our capacity. Critical care census is 17. Our persons under investigation total 9 in critical care and 8 more in medical surgical areas for a total of 17. 3 of those are confirmed positive. In the emergency department, we had 89 visits yesterday, continuing our pattern of very low ER volume. We have 7 ventilators in use at the present time. A few things to tell you about today. One, we began a process yesterday of decontaminating masks. The N95 masks that we talk about every day and are in still short supply. There is a process that was developed at the University of Nebraska Medical Center. It's called UVGI. Ultraviolet germicidal, irradiation, ultraviolet germicidal irradiation. That allows us to use the ultraviolet cleaning systems that we have. We have several of them that we use to decontaminate patient rooms after a patient leaves. We've put one of those in a room with the masks hanging, excuse me, and they can be decontaminated by this process developed at the University of Nebraska. The typical N95 reuse policy has been 4 shifts. They're used by a single employee with a single patient for 4 consecutive shifts, preserved in the meantime, and then discarded. This UVGI process, we expect to allow us to extend the life of an N95 4 times. So 4 times 4 shifts or 16 shifts worth of use. That just began yesterday. We're very excited about the ability to stretch that vital piece of personal protective equipment. We're doing that only for our own masks. We won't take people's masks from outside in the community and decontaminate those, but we're excited about the option for doing it for the mask we use with our own staff. We've talked some lately about the financial challenges that healthcare providers are facing and will continue to face. as we deal with the costly care we are providing to the COVID-19 patient population and those suspected of having the disease, and also especially with the declines in revenue we're experiencing that come from not doing elective procedures of all different kinds. That's particularly difficult for hospitals as we face being on the front line of managing this disease. But there is some relief on the way. We have, in one of our practices, already received some of the advance payments that the Medicare program has promised. We expect that there will be about 6 months worth of advance payments coming to the hospital within a few days. That is not a grant, that's a loan, a working capital loan from the federal government. They'll give us 6 months worth of typical Medicare payments, allow us to hold that for 4 months, and then begin to take the money back after a 4-month period. So it's a relatively short-term, interest-free working capital loan, but should certainly help with cash flow. There are other programs that are in the works. We have heard 2 days ago now that the $100 billion element of the CARES Act that comes to hospitals is being put together now by CMS. The first 30 billion of that is expected to be distributed soon. We are not completely clear on the rules for that, nor on the timing, but we're encouraged that relief may be coming soon. We are just closing out our March financials. We did take a bit of a hit in net revenue in March. We're projecting what the rest of the year looks like and putting together the plans for how we expect to manage that. But as I've said a couple of times now, the highest priority we have is maintaining our ability to care for the community with all of the needs that present to us and keeping our workforce intact and allowing our people to continue to work wherever possible. And we will continue to keep that commitment as long as we possibly can, and look forward to laying out some better educated financial plans over the coming weeks. A couple more things to add. We're very excited about the addition of an infectious disease physician to the Texas Tech faculty here in Midland and somewhat also in Odessa. Dr. Eduardo Iragui has just joined the Texas Tech faculty. So now we have 2 infectious disease physicians practicing in Midland. And that's very exciting for us, especially in a time when we're actively dealing with infectious disease in the community. So welcome, Dr. Iragui. Finally, my last remarks, a shout out today to our COVID unit staff, the nurses and unit coordinators and nursing assistants, and all of the others who are working directly with the patients who are under investigation or are actively suffering from the COVID-19 virus. These are the people who are absolutely on the front lines. They're in and out of these isolation rooms every day. There are big users of personal protective equipment and the people for whom it is the most important protective gear that they can have. These folks are doing everything. Unlike our typical environment where our housekeepers come in and clean rooms and our dietary personnel deliver trays, the nurses are doing all of that for these patients, cleaning, delivering meal trays, every aspect of the care of the patient to try to minimize the traffic that's in those rooms. So that increases their exposure to the patient and to the virus. And these are people who are extremely dedicated, and we couldn't do what we do without them. They're also keeping a great sense of humor. I've gotten a couple of different videos from the people in those areas where they're trying to have a little bit of fun, inject a little bit of levity into the work that they do, which is very, very serious. So serious shout out and praise to those people working in our COVID units day in and day out. Thank you all very much for the great work you're doing. So I'll pause here and see if there's a question for me, and then I think Dr. Wilson has a couple of comments he'd like to include as well. Any questions?
Well, for media, as a reminder, you're supposed to click the raise your hand button, and then I'll unmute you and you'll be able to ask your question, but I don't see any hands raised. So.
Anything from Facebook, Tassa?
Oh, let me
Okay.
check the chat.
All right. Dr. Wilson, would you like to come forward and make your comments, please?
Oh, wait, we have one for you.
All right. Go ahead.
Okay, Sammy said Midland Health received $982,000 in a new round of coronavirus relief funds appropriated by Congress. Why are the funds needed? What specific things are you going to use the funds for?
I'm not sure exactly what she's referring to, but there will be funds appropriated by Congress through the CARES Act. And as they come in, what they will primarily be used for is to recover from the lost revenue we've experienced. In the month of March, as we're just closing, we're down more than 15% in net revenue. We will probably lose $3 million on the net income line in the month of March alone. And remember that March was only about half a month of impact. So as we look at a full month's impact in April, that probably makes the projection even worse for the month of April. We're hopeful of recovery beyond April. But the most immediate concern for us is continuing to meet our payroll, continuing to have money for supplies, recognizing that our revenue stream has been severely interrupted. So the money that we get is primarily replacing lost revenue. Our expenses have not gone down. Our people are still on the payroll and working. We're still spending a lot of money on expensive equipment, especially personal protective gear that's gotten much more pricey since this crisis unfolded. So that's where the money goes. It keeps the business running, gets applied in a lot of different ways.
Okay, that's all we have. If Dr. Wilson wants to come up.
Morning. I wanted to just bring to everybody's attention what I'm sure most of you have heard already, that yesterday was the most severe day in terms of mortalities across our country. We got over 2,000 deaths across the United States, a lot of them in New York City. That's very sobering, and I hope it gives us all pause and recognition of how serious COVID-19 has been to our community and worldwide. At the same time, it's also a harbinger, hopefully, of a better day ahead, because as they peak, we reach the apex of the curve, and we're hoping that New York is on the downward trend in the near future, if not already, and we'll start seeing improvement in the outcomes in their city. We recognize across the country that everybody's in different stages of this disease, and we're not all on the same trajectory that we see in New York City, but it provides a degree of cautious optimism that there's an opportunity through what we've been doing to be successful with this. And I want to remind everybody at the same time, soberly, that we had on the 31st of March, 15 diagnosed cases through the testing here in Midland. And on the 6th of April, 1 week later, we were at 30 cases. Now, we actually got a couple of those results back a day or two after the 6th, but they were tested on the 6th. So within 1 week, we doubled the number of cases in Midland. That should serve to remind us that asymptomatic people are carrying the virus, that people before they become sick for a day or two might be carrying the virus as well. It's very serious, and it remains that way. But if we continue on the course that we've been on with the social distancing, wearing our masks, frequent cleaning of surfaces, all the things that you've heard me, Russell, the mayor, repeating multiple times, we have an opportunity to bend the curve down and change the models that we've been hearing about over the last several weeks. Some of them have been very scary, with this trajectory going on all the way into August or later, with the peaks, coming much, much later. Now the models are beginning to show that what we've done, what you've done, the citizens of Midland and around the country have done by practicing these difficult tasks that we've asked you to change your lifestyle so much around. By doing so, we've changed the trajectory, and it looks like the models are suggesting we may be through the worst of what we've got going on currently before the end of, or around the end of April. That'd be really nice if we're successful in doing that, but it only can occur if we do the things that we've been doing and stay the course, please. And recognize too, that if we are able to do that, and there is a time when the mayor and others can begin to speak about how do we liberalize things and get back towards doing, get the economy moving again, we have to do that carefully. We can't just jump in with both feet, or we'll ramp this thing right back up again. This is a very transmissible virus, and it remains in the community. And the reason we're seeing such a flattening of the curve here is because of all the things that you all have done. So I want to say thank you, but I also want you to remain cautious. So with that, if any questions?
I'll give them just a few seconds to see if they have any to type, but nothing yet.
Okay.
Oh, hold on here. All right, Stuart, go ahead.
Good morning. We're being not inundated, but we are being asked by commoners all the time that the number of cases in Midland is one thing, but there are also maybe some people who believe that there's been a whole lot made of the coronavirus. Get to the question, what do you say to those people who believe that the low number of cases, the people who have already gone through and have recovered, that it's really not that big of a deal here, and that we should be we're making too much of it just by saying that this is how many cases there are, and that we're making too much of just kind of this whole thing.
So I think everyone has seen what has happened in areas that were more cavalier about their approach to this virus. You remember the nursing home in Washington State. There's been one in Maryland as well, and other places around the country. The reason that we have been able to bend the curve down and make this seem like an overreaction is because we kept it away pretty effectively from the vulnerable population. Certainly if young people and kids are infected, the vast majority of them do very, very well. You've heard the numbers of asymptomatic people that have the infection but never develop any symptoms. But if they're exposing their grandmother or an elderly person or somebody with an immune deficiency or diabetes or other underlying healthcare issues to this virus, it could become very, very serious very, very quickly. We got into a nursing home, et cetera. So I think you might recall that over the last couple of weeks, you've heard myself say, the mayor say, I think Russell said as well, that we all hope that we're going to reach a day where we'll look back at this overreaction. We didn't need to do all of those things. But the only reason we'll be able to say that is because we did all of those things and we protected everybody from this virus. And so I might not hear that sort of courageous stance, I guess, or whatever you want to call it, that, hey, why don't we just drive on with the mission and not worry about this nearly as much? We will get through it fine. We only will get through it fine if we keep everyone safe from the virus.
All right. That's all the questions that I have.
Thank you.
All right, now it is Becky Smith from the Health Department. Becky, whenever you're ready.
Good morning. This is Becky. So as of today, the city of Midland or the county has 30 confirmed cases. Their source exposures are 13 travel related, 14 contacts to a known case, and 3 community acquired. The genders break up as 14 male, 16 female. The age groups are 0 to 19, 2, 20 to 29, 14, 30 to 39, 5, 40 to 49, 3, 50 to 59, 4, 60 to 69, 2. The isolation status: home is 13, hospital is 2, complete is 14, and recovered is 8. And I'll come back to the recovered status and explain that. Medical visits where they were tested, the drive-through is 15, the clinic or private provider is 7, the emergency room is 6, and inpatient at Midland Memorial is 2. Our investigation status, ongoing, is 27, and complete is 3. Our deaths in the county remain at 1. Back to the recovered status. This is a new status that we have as a request from several of our city council and our mayor. It is a definition that with our public health authority, we have arrived to. It is when a patient can return back to normal daily activities like work, daycare, and et cetera. And so of our 30 cases, we have 8 that are recovered. I would also like to bring to everyone's notice that of the isolation status, we did go backwards on one at home. Our numbers recently at home, we are complete. We had 15 and now we're at 14. That is because we did have a patient that was recovered or that was complete and then started symptoms again. Dr. Wilson had mentioned maybe last week, or he had mentioned recently, that with COVID-19, the symptoms wax and wane, they come and go. So that's why when we release someone out of isolation, we still tell them, if you start symptoms again, let us know immediately so we can, you stay in isolation. And if you don't still feel completely well to go back to work, that's when we do not release you to be recovered. Recovered is a different status than complete. So that's why a patient went back into isolation. So in case you have a question about why the complete went down a number. That is all I have.
All right, Becky, just 1 second. Let me see if we get any questions. Okay. Whoops. Where'd you go? Okay, Sammy.
Good morning, you guys. Hey, Becky, I'm just curious as to how tracing is going, tracing people in the community who might have been exposed from those positive cases.
For the most part, it's well. The actual cases give us information. Employer, if we have someone that's an employee, the employers help us with contact information once we have names, if the actual case didn't have information, and we are getting a hold of people. It is difficult at times if we don't have correct phone numbers, but for the most part, it's well. If we have contacts that are from other cities, towns, even states, we locate our regional state health department and give them the information, and it goes up the chain. We don't get a hold of everyone the first time, but we keep trying. And for the most part, it's well. It just takes time, and that's part of the investigation process. But we investigate infections, on a daily basis. All of my staff is cross-trained on investigating every one of the Texas notifiable conditions. And so it is something that, we're used to. COVID, we're not used to, but the process we're used to.
Okay, Becky, and we have one from Mitch via the chat. He said, what is the criteria for the recovered status? Is it possible for any of the individuals who have recovered to continue to spread the virus?
The recovered status is when a patient feels well enough to return back to normal daily activities, work, daycare, etc. And that is days after someone is out of isolation because, for example, the one that went back into isolation. So we do not do that immediately after someone is out of isolation. We give them several days later before, it's they become recovered. It is either in conjunction with what our health authority says or with what their provider says, if they're seeing a provider. Before we announce them recovered. And along with several employers in the area, even when someone is said to be out of isolation, they're wanting them to stay home anyway, just in case. As we have said, COVID-19 is a very fluid process. The whole response to COVID-19 is very fluid. Every day we know something different. And so, that's why the recovery process is much longer. Every day something is known different. There's no 100% when we can say someone is no longer contagious. So the recovered process is days later.
Okay,
Okay. All right, Becky, thank you.
Thank you.
And now we will move to MISD. Mr. Riddick, you're good to go.
Thank you. Again, this is Mr. Riddick, Superintendent for Midland ISD, and I want to share our Thursday, April 9th updates with all of our community members around the school. I want to first begin by thanking and sending out a shout out of appreciation to so many people who stepped up and raised their hand to support the work that's ongoing and have taken the place of teachers who are now delivering classroom into the home in regards to delivering food to many of our furthest reaches of our county twice a day. And, you know, that's already occurred by this time that we're now engaging in this, this information session for our community. That morning delivery is critical to so many of our kids, as well as individuals who are taking meals, which we call our Meals on Wheels program, to homes where they cannot get to us, and making that delivery as well. The same can be said for so many unsung heroes who are stepping up to the plate each and every day and continue to raise their hand as they ask, how can we help? The we is a very important factor within that entire statement, and it says so much about who we are as a community. And I want to thank all those who have made that come to fruition and stepped into the gap for so many who did not realize that there were people there to help them through all this. For all those who are out there who are doing the right things that we've asked from either the mayor or from the hospital, and who are making sacrifices of staying home when you'd rather be out or sewing masks or delivering meals, I want to say thank you because that is making an impact for us as a community. As I talk to colleagues from around the state, around the country, I share that Midland does not feel that chaos that I see happening in so many other areas, whether it be from the school system, from the hospital, from the government side. I appreciate all those things, and I will continue to reiterate that the team assembled has done an incredible job to ensure that our city stays at the forefront and ahead at the tip of the spear in tackling this entire situation. I want to share that beginning Monday, we're going to move to the 20th. So Monday, April 20th, again, Monday, April 20th, we're going to be moving to a one-time a day meal feeding. That's to help as well through this entire transition. So that'll be in essence the last phase that we would move into around our food. That'll be a 10:30 to 12:30 delivery where you get both meals at one time. So you'll get breakfast and lunch during that time. And then it would help not only that we've done this with our volunteers who are pushing out, but it makes it cross-functional through all the work that we have that's ongoing currently right now. Right now, we have volunteers who are delivering 122 meals to 40 different addresses, and that's our Meals on Wheels program. We have over 1,100 volunteer hours that have been captured at this point right now. So you can see how a community, when asked, really steps to the plate and makes a huge deliverable to what that looks like. We have 535 volunteers, members and MISD staff that have completed the volunteer form, representing what that looks like. So some of those were teachers early on. Well, teachers have gone back into the classroom, so we had to have people who stepped into that gap. So having that large number of over 500 volunteers step up certainly allows us to continue our mission. There's been questions about technology. Those came out on Tuesday, so I just want to circle back to several of those. So right now we received over 600 requests for hotspots. We have 1,000. Our team is formatting those hotspots so that it provides the best feasible way for kids to access and get online, and kids don't have the ability to explore a whole lot of other things that kids can get inquisitive about. And so our team is working through that right now to make that a deliverable. We've given out over 1,100 devices. Those are Chromebooks to our community members. Want to share that we've had other options that are built in as well. So we have information that if you need internet service into your home, that there are providers in our community that are giving 2 months free for internet. And if you have and if it's an economically disadvantaged situation, that can go on beyond that for $5 to $10 a month. You should explore what that could look like for your home. We have that online at our COVID website so that you can see what that looks like. We boosted the Wi-Fi to go out into the parking lot area so you can be in your vehicle. You can maintain all the factors that we have that sit out there if you need to get access to your academics. And so you can be in the parking lot area. We have 9 campuses that have that boosting that goes out to the parking lot area. And that's going to be at SJ, Young Women's Leadership Academy / Jones, Carver, Lee Senior High, our transportation bus barn up north, General Franks, South Elementary, our central office, and Goddard Junior High. So if you want to see what that list looks like, please go to our website, which is going to be at midlandisd.net/COVID-19. It'll give you a map for what that looks like to be able to access that. There are questions that came out as well. So starting Monday, we're going to have Wi-Fi available to go in conjunction with our county meal locations. That's going to be at Batesville, Valley View Baptist Church, Fire Station number 4, Twin X Trailer Park, Airline Mobile Home Park, and Cotton Flats Baptist Church. That allows you to either be in your vehicle up close to the bus so that you can gain that Wi-Fi access. We're working through whether you get on the bus and sit and take care of that. And we have to think through that through our healthcare team to know what that means to have that disinfect and have those buses come back. But for right now, if you can get close to those buses, you're able. If you have your personal device in any of those situations, you want to connect to the Midland guest, that will get you access to the information that you need to go to. If you have one of our Chromebooks, you'll automatically get plugged in and be ready to start up. I want to thank the city. I want to especially thank the mayor and his IT team, which have also boosted Wi-Fi in these locations as well, which are at Hogan Park, Doug Russell, and Washington pools. It allows us to not only utilize what's in our building, but what's in our community to do in a way that provides what are some best case ways for people to gain access, whether it's in your home, whether it's in a building, or whether it's in an area close to you, or whether it's a bus that's coming into your location. So know that we're pushing this in a way to help inform our community on how to get access. Knowing this is all new for us, I want to let people know as well that we are standing up a technology helpline. I think it's important that as people meet challenges that come with bridging this digital divide and moving towards what is less paper and more technology, we have some families that are having some struggles around that. So we'll have a helpline that'll start on Monday. So just look for at the website for the number, and we'll be able to get you stood up right away. We've had to navigate our entire professional staff around the technology that they're gaining with their students. And now we're ready to launch out what would be an opportunity for our parents. So parents, it's coming, and that help is on the way. I want to also share that help has been on the way. We've had teachers who have gone to homes. As an example, we had a grandparent who was taking care of 4 kids, and it struggled in a lot of different ways, I'm sure, for the family. But the teacher went to the home and walked the 4 kids from a safe distance. They were inside the home. The teacher was outside the home, and walked the kids through how they should navigate the Google Classroom and logged them in and got them all set up for their classes. We have teachers who are doing a remarkable job, who are giving what is a best case scenario for many, many families. If you've not heard from your teacher, I would say, please call, because I'm sure that that could be the case. Our teachers are calling. It's an unidentified number. And if you can see in many situations, when you get a number that's not in your contact list, or a number that seems like it's from a different location, we're not answering the phone. But no, we have staff members who are calling to check up on a number of categories for your student. So if you've not heard anything by this stage, please reach out. Just a closing remark, the state has a number of things that they're asking us to do around food. We're gonna have documentation that's gonna go out there for parents to gain a letter and document the kiddos. That's if you're picking up food without your student. The Texas Department of Agriculture has a number of things that parents need to provide and bring, and we're trying to follow what are those guidelines that are going to be where we will be audited at some point in time to ensure that we've made that a deliverable. One of the things that the Texas Department of Agriculture has said, that because Good Friday was going to be a student holiday, that we don't get compensated in essence for the food that we're going to be doing for Good Friday. We are feeding on Good Friday. We're still going to have that for our community and let our community know that we will have breakfast and lunch on Good Friday. And we are going to, in essence, absorb what that cost is. And there'll be other costs that we'll have to work through this entire piece as well that we are beginning to absorb. So we know that that's going to be ongoing, and appreciate what our community has done to allow us to reach out in so many different ways to walk us through this process as we begin our platform of Google Classroom and bringing the classroom to you in your home. It will be a challenge. We have parents who are being challenged, even though it's a 2-parent home and they have all the resources and the technology, and navigating 3 different kids at 3 different grade levels. I will tell you, it is a challenge. It will not be easy. We're not asking you to deliver an 8-hour day. We're working with our teachers on how much they're trying to push in, because what I've seen is you can actually get more in the home work-wise than what you may have been getting in the classroom, because all your teachers want access to you at some point in time. So we're bridging what that looks like so that we keep the passion of learning alive, and we don't diminish that as kids come back into the building. It's not the replication of an 8-hour day. It's a way to allow kids to still explore, to learn, and still to drive themselves in a way that reaches those academic goals. We stood up a Senior 2020 website. So if you go to midlandisd.net/seniors2020, it's giving our seniors, the class of 2020, a lot of information in regards to next steps and what's occurring and what's happening. Some of those are still ongoing and to be determined, but it's providing a way for our members in our community to begin to capture what is my situation and how do I then go forward next. With that, I'll just open up for questions.
All right, from Stuart Doreen, he is asking any decisions on graduation and how final grades will be determined.
Yeah, so one of the things that we have around graduation, we're still in a wait and see. We hear from Dr. Wilson what it might mean for our community. I still would become hesitant if we were to, become clear and flatten. And at the end of April, we know we had the end of May, trying to put 8,000 people together in an arena. I don't know if that's the best scenario that early. And so we're still seeing what that could look like for an end of May graduation. Do we as well push that time frame further out? So one of the first things you'll see with seniors of 2020, we've not diminished what that could look like. So we have 2 plans that are going forward. One is if the college has the arena available, because that's our largest arena that we have access to gather that many people together. What does that look like if we were to go to the formal way of graduation and the time frame, and could we move that time frame in or out? More likely out. If that's not available, what does a virtual graduation look like, and how can we provide this opportunity for our community to still have this experience, but it's not done in the arena and it's done in a very unusual sense, which would be a virtual graduation. So we have those 2 plans that are working themselves out. We spent time with our team yesterday. We had 154 leaders in our community, in our school district community, in a virtual meeting, a virtual hangout, we call it Google Hangout. And with that, we began to explore and share how we're moving and progressing forward. So right now you have the first 6 weeks, the second 6 weeks, the third 6 weeks, and the fourth 6 weeks embedded. It was in the fifth 6 weeks that we went into spring break and then went into closure. So we have 3 9 weeks or 4 6 weeks of data and information that have grades related to them. So we have that data. So what I've shared with the team is that this is more like a mixed methods dissertation or college paper, where you have quantitative data that allows you to know where a student is, and you have the qualitative data, which we are going into right now, because we are not grading from this standpoint, because we know the digital divide is creating inequity around our entire system. So with that, we are providing a way to gain feedback and give feedback to students. So we are working through what would be the grading methodology to say that this is how you will advance from grade to grade. This is how you will gain your credit at this point in time. And in essence, are you on track to navigate to the next grade level or to graduate? And so that's the work that the team is embedded in right now. and our teachers will be getting that information here this week, and then we'll be rolling out what are the next phases in regards to calculation. The first thing parents need to know is that Family Access is a tool that we have as a school system that allows you to check your students, whether they're in class on time, whether they've been in class, or what their grade looks like. I've spoken about that a number of times. In there, you get a progress report that allows you to know what is the progress of your student. It's important that families get logged in and sign up. You can do it via your smartphone, as well as any of the devices that we've used to push the classroom to you into the home, so that you can gain information to know what the progress and the status of your student is currently right now. We're going to be sending out progress report notifications so that parents can log in and check their progress report and get that information, so we can make the first determination of here's where you stood and are you on track now in order to progress through what would have been the 5th and 6th 6 weeks.
Okay, that's all we have. Thank you.
All right, you're welcome.
And now we will move to the county, and Justin Bunch with our emergency management is going to speak first.
This is Justin Bunch, Midland County Emergency Management. A couple of things I want to hit on first is just some points from the governor's office that I thought were interesting. On April 7th, the United States Court of Appeals upheld Governor Abbott's executive order GA-09, which requires all healthcare facilities and professionals to postpone any unnecessary medical procedures to free up hospital beds and preserve precious medical supplies for those combating the spread of COVID-19. Apparently that executive order was challenged, but it was upheld by the courts. On the 6th, Governor Abbott also announced that Texas had received 2.5 million masks in the past 24 hours. And the state is supposed to be receiving an additional 3 million masks by April 11th, which is outstanding. And those resources will be divvied out throughout the state, county, and state offices. The last one from the governor's office was on April 3rd. The governor announced that hospital bed availability in Texas has increased by over 140% since March 18th. Now an update on what we're doing as far as a county level. Our office continues to accept donations in PPE on behalf of the Unified Command teams. We're also accepting donations in supplies as far as sanitizers and disinfectants for our first responders. On Monday, we received over 300 gallons of hand sanitizer from a company in Oklahoma, and we had a private industry here in Midland actually transport that for us, and we got that yesterday, and we're starting to disperse that out to everyone that needs it for first responders. Resource requests have also been filled for Meals on Wheels, West Texas Food Bank, and several local assisted living facilities. We've been in contact with Ector County Emergency Management and working with their elected officials in their offices to share information and give them situational awarenesses on what we're doing in Midland County and what they're doing as well. We continue to track the cost for the public assistance grant that was opened up to Texas jurisdictions during the disaster response. And we'll continue to do that throughout the remainder of this incident. And lastly, we continue to coordinate and collaborate with private, local, state, and federal partners to ensure we're providing the best possible response for the residents of Midland County. Without that, I'll take any questions if there's any, Aaron.
Okay, let me see if anyone raises their hand. Justin, I think you're good. Judge Johnson, okay. You are good to go.
Okay, thank you. Judge Johnson, Midland County Judge. I'd like to start out with thanking everybody that's sacrificing for what we're going through. It's a horrible time, but Midland is up to the challenge. I think you've heard some positive things from everybody. I would like to start with Monday. I began a conversation of how can we assess the health of Midland County. The information we're getting, and we're getting a lot of information. The hospital has given unbelievable amounts of information. The state's given us a lot of information, but I kind of wanted to see what can we do to gauge the health of our community in a good way. And from Monday until today, we are ready now to roll out something that I'm real proud of, that we're for short, we're calling it CHAT, C-H-A-T, but it stands for the Midland County Health Assessment Tool. It's an emergency management tool that is going to utilize texting technology. And essentially, in the beginning, we're going to ask you if you want to be a part of this, and I hope everybody will take advantage of it. If you will text CHAT to 432-287-7337, this will opt you into our system. Please know that this is an anonymous system. Your number is nothing but an encrypted information mixed with a whole lot of other encrypted information. We don't know who you are. We don't want to know who you are. We're not here to diagnose anybody. What we want to do is try to gather some trend data. To me, information is power, and there's power in what folks can tell us. So originally, we're going to start out by asking you just a couple of questions. It won't be lengthy. It'll just be 3 questions, such as your zip code, which will allow us to figure out if there are hotspots in Midland, good or bad, your age range, and then also we're just going to ask, do you have any of these symptoms? And we've listed fever, dry cough, shortness of breath. Again, we're not trying to diagnose anything. We're just trying to gather some information. Dr. Wilson had said earlier that as we ramp up, it's important to have informational trends. And maybe this will give us some trends of things are going up or things are going down. What's going on in the hospital is one set of data, but what's going on out in our community is another set. And so we would like to tap into that. You can opt out of this at any time. You'll never be approached for any other reason than this COVID situation and what I've just spelled out. Again, it's anonymous. One other benefit of this, if there are any changes in the emergency management plan, or if the governor makes an announcement, or if the county or the mayor makes an announcement, you'll be the first to have this information pushed to you in a text message. So it's a process. It's something that in 4 days has come a long ways. We're ready this morning to launch it. So with that, if there's any questions, I'll be glad to answer, but we're looking forward for everybody to take part in this and help us build a database of what's going on in our community.
Okay, Judge Johnson, we'll just give them 1 second to see if anyone has any questions.
Okay.
All right, I don't have any. Judge Johnson,
Okay.
Thank you.
All right. Well, I hope everybody will participate. Thank you.
Mayor Payton, it's all you.
All right, thank you very much. Thanks again to everybody that is going through really the inconvenience of everything that's happening. Thank you again to the press corps for being flexible with us. And thank you, Aaron, for getting everything put together and having all the pressure on the very first Zoom press conference we had to do. So thank you for that. And just sitting here during this conference, listening again to Superintendent Riddick, just a huge thank you to the school district, to everything they're doing. I know that they probably haven't heard this there, but I continue to literally hear from around the country about Midland. People are watching Midland, seeing how things are being handled. I continue to get emails on a constant basis about what people are watching and seeing from the Midland community, what they're seeing and hearing from the citizens. And so quite frankly, just a huge thank you to everybody involved and staying ahead of this and being an example. And so thank you very, very much to everybody. On the just very specific COVID-19 side related to the city, I think I may have missed it earlier, but I do just want to take a minute to reflect upon the day that we had yesterday with no new cases that were reported yesterday. So that was you could call it a milestone. I would not call it something to start building upon yet, because I'm sure that, as you all know, we'll continue to have more cases here for a while. We don't know what that's going to look like in the future. But that just leads me to say thank you to all of you again as Midlanders for everything you've been doing, for the social distancing and all the things you've been asked to do and the sacrifices you have been making. I have a very, I guess you could say I have a sense that over the next week, maybe the next 2 weeks, it's gonna start wearing on you. I know that all the different things people are having to go through, being at home, educating their children, valuing teachers even more as they go through this process, people who are working from home. There are many, many things that are just a high stress right now. So I just want to encourage you to take care of yourself. As the judge mentioned, to take care of your mental health, not to think you have to hoard like we're in some disaster declaration as far as groceries are concerned, and just keep fighting the way you're fighting. Thank you for the things that you are doing. Thank you for the humor you're interjecting into things like waiting in line and different things that you are doing in this community. Cannot thank you enough. There are no new restrictions we're going to announce. We just want to ask you to stay after it, stay committed to it, and stay as joyful as you can through the process. I do want to mention a couple of things about our economy and the workers who are out there. It's one thing for us to continue to fight and have good attitude about fighting a virus we cannot see. But the reality is we also continue to see a number of unemployment. Our numbers are rising. We're continuing to get notices of layoffs, and this is continuing to create stress. It's continuing to create pressure. And so for those of you who are having to work through unemployment, for those of you who are working through this transition and it's even elevating the stress, I was looking again this morning at the Texas Workforce Commission, and they're just overrun. Every department that deals with unemployment, that deals with small business administration, and the Paycheck Promise initiative that's out there, everything is overrun. And so for all of you who have said, I've been calling and I keep getting busy signals, I've been trying to get an answer, the easy thing for me to say would be, it's going to get better, but I don't know when it's going to get better. You're just going to have to keep trying and keep emailing and keep trying to connect. Texas Workforce Commission on their website this morning actually said your best option is probably trying to connect via online between 10 p.m. and 8 a.m. So I wish I had better news other than to keep trying. I know that the federal government is continuing to work and the state is continuing to work on things that we can do, but use your online resources. There are online resources at the City of Midland website. There are online resources at the Chamber of Commerce. I know it is a very difficult time. It's hard to combat two enemies at one time along with all the stress, but I want to just continue to encourage you to keep doing the best you can, which means that all of us need to be looking out for our neighbors as well. We'll be meeting again as a city council on Tuesday, and as a council and as a city staff, continuing to talk about things we will have to do and need to do for those of you living here in Midland and in the area in these very difficult times. On the national front, there have been some questions about conversations I've had with the Department of Energy and other people in Washington, D.C. and in the state of Texas. I just want to tell you very clearly that our Texas delegation, whether that's Cornyn or Conaway or Cruz, need your support. They need us writing them. They need us emailing them and defending the oil and gas industry. I want you to just make no mistake about it, as I have been on the phone with people in Washington and through the bureaucratic channels, that it is absolutely, and this is probably more political than this time needs to be, but Pelosi and Schumer are doing everything they can to destroy West Texas. And so we need to keep fighting. We need to let our delegation know how much we support them. We need to give them the courage to stand up against what's happening in Saudi Arabia and Russia. And there are many things we can do to continue to make our voices heard, especially if you're sitting at home and you're probably not putting in an 8-hour workday. And so take a minute to email your congressional delegation and make sure they put America first. And we can continue to elevate that discussion right here in Midland as I continue to push into that issue as well at the state and federal level. So again, thank you for everything that you're doing. I pray that this is a blessed Maundy Thursday for you. You may have seen some social media posts. Whatever your faith tradition is, I hope you'll pause at noon today for just a time of prayer and for our city, for one another. And then as we enter into this this Easter weekend, as I mentioned before, I hope that you will consider the sacrifice we celebrate on Easter and how it calls us to sacrifice for one another. So thanks again for everybody on this call. And Aaron, with that, I'll be happy to take some questions.
Okay, let me see. I don't have any in the chat, so let me see if anyone raises their hand. Anybody? Mayor Payton? I think we are good. Oh, wait, we have one. Mitch is back. Okay. He said, as more Midlanders are staying home, have MPD officers seen a jump in domestic violence calls or any other emergency calls? Is the police department doing anything specific to reach out to individuals who may be stuck in a bad situation as they social isolate?
Good question. I have not heard a direct report as to an increase in domestic violence, but I will tell you that that is a great concern among those who are working with our teenagers and children in foster care situations and in difficult situations at home. So unfortunately, my answer to the question is I haven't heard the report, but the other side of the unfortunate answer is for those who are studying these trends with families and family pressure, they're telling us that they expect it to get worse before it gets better. And a little bit of anecdotal evidence or data is that in the Wuhan province of China, petitions for divorce have gone up 91% through this coronavirus. And so people are people anywhere. And so you can see how the stress of this is taking its toll on people. So we need to be vigilant, checking on our neighbors, making sure we're doing the best we can for our kids and our families. But the answer really quickly is no direct data yet, but I would be surprised if we're not seeing an uptick in that.
All right, Mayor Payton, that was the only one.
All right. Thank you, Aaron. Thank you, everybody.
Thank you.
We out.
We're out. Bye, everyone. Thanks for watching.